Reducing infant mortality rate experienced in African American women in Caddo Parish, Louisiana. The state of Louisiana is experiencing a high infant mortality rate that is significantly higher than the national average due to a high rate of preterm deliveries in the African American population. As of 2015, the state of Louisiana had an infant mortality rate of 7.5 deaths per 1,000 live births, significantly higher than the national average of 5.8 deaths per 1,000 births. The leading cause of infant death in Louisiana is due to birth defects. This is followed by low birth weight and preterm deliveries. In 2013, 171.1 per 100,000 births resulted in death due to low birth weight and preterm deliveries. The population that is most affected by infant mortality and premature births in Louisiana is the African American population, which experiences preterm births at a rate 49% higher than that of white Louisiana residents. African American women are more likely to be of lower socioeconomic status, which creates financial barriers to care and increases stress and risky health behaviors. Risky health factors associated with preterm birth, such as smoking, occurs in 23% of Louisiana women who are of childbearing age, and obesity occurs in over 30%. It is important to examine all of the socio-ecological factors that are associated with the positive birth outcomes in Louisiana. At the individual level, managing chronic disease, substance use, and seeking prenatal care are positive reinforcing health behaviors. Women who have social support, including support from family and friends, have a positive correlation with accessing prenatal care and positive prenatal health behaviors. At the community level, social support programs with laypersons, such as community health workers, have demonstrated positive birth outcomes by providing support and education to expectant mothers. To reduce unnecessary preterm deliveries, some organizations, such as malpractice insurance providers, are providing education to physicians on the dangers of elective preterm deliveries. Louisiana has established a statewide pay for performance program for progesterone treatment, which has proven to safely reduce the occurrence of preterm birth. On the other hand, there are also negative socio-ecological factors associated with poor birth outcomes. Individuals who are of a racial minority group and those who engage in risky health behaviors experience poorer outcomes. It has been suggested that poor outcomes in African American women are correlated to the lack of support from a partner. Hospitals are performing unnecessary induced labors at an increasing rate, and lack of trust within the medical and public health systems surrounding reproductive services poses a barrier to prenatal care. Lastly, insurance programs such as La Moms provides prenatal care, but if a woman is not eligible for Medicaid before her pregnancy, she has health behaviors and medical problems that are not addressed by the insurance. I have identified 3 evidence-based interventions that have shown to be associated with positive birth outcomes, including higher birth weight and reduced preterm labors. These include group model prenatal care such as centering pregnancy, which is shown to be associated with higher birth weights than traditional one-on-one prenatal care. Providing education on dangers of elective preterm labor has shown to be associated with a decrease in unnecessary late-term preterm inductions. And community health worker services have shown to improve maternal child health outcomes by offering support and encouraging mothers to adhere to treatment plans, as well as acting as a liaison between the provider and the patient. Based on the information gathered, I am proposing a pilot intervention program for women of Caddo Parish, which has the highest preterm birth rate in the state, according to the March of Dimes. African American women will be recruited for a once-a-week, 12-week group prenatal care program. In this program, they will receive wellness check-ins and biometric checks with a nurse midwife, receive education lessons varying from nutrition, physical activity, pregnancy and labor expectations, and abstinence from substances. They will also receive monthly one-on-one home visits and bi-weekly phone calls with a community health worker. Lastly, staff from NICU will present the dangers and outcomes witnessed associated with preterm births. All three interventions will rely heavily on data collected from post and pre-surveys, allowing for a simple evaluation if target goals were achieved or not. The target goals identified are to reduce risky health behaviors, reduce elective preterm labors, and to increase perceived social support. Pre- and post surveys will request demographic information, will have participants disclose risky health behaviors such as physical activity, eating habits, smoking, and substance use, as well as assess an individual's opinion and knowledge of elective preterm deliveries. In addition to assessing if the desired outcomes or target goals were met, the evaluation process will include assessing whether or not the activities and the format of the program were delivered as originally planned, and will note any change that was made to the original plan. It is just as important to assess whether the target goals were met as to assess how they were met, to demonstrate a possible correlation between activities and the outcomes. One potential challenge to this intervention is false reporting on surveys. To reduce this occurrence, surveys will be de-identified. Participants will receive a participant ID number. Another potential challenge is participant dropout. To encourage participants to remain in the program, a gift card incentive will be given to those who complete the program with an 80% attendance rate and who complete the post-survey. Here, you will see the logic model of the proposed intervention, highlighting the necessary inputs, such as the program staff, educational materials, time, funding, evaluation staff, and participants, as well as the activities, which are the interventions we proposed. The delivery of prenatal care in a group model, education on importance of 39-week delivery, and social support, which will be provided by community health workers. The expected outputs of these activities are access to prenatal care, increased education on risky behaviors, increased awareness and knowledge on dangers of preterm elective births, increased social support during pregnancy, and liaison between provider and patient from the CHW. The outcomes expected are a reduction in risky health behaviors associated with low birth weight, reduction in elective preterm births, and increased use of prenatal care, as well as an increase in positive prenatal behaviors. All of these outcomes are in hopes to reduce the infant mortality rate experienced by African American women of Caddo Parish. Thank you for your time.